This is Holly Avey. I'm going to welcome you to the webinar this morning. Thank you so much for joining us. This webinar is sponsored by Health Resources in Action. It's a part of the Health Impact Assessment Training Series, which includes another conference coming up on May 31st at Clark University in Worcester, Massachusetts, as well as a final webinar on June 13th, which would be focused on evaluation and reporting, and that will happen on June 13th from 10 to 11:30 a.m. And there is a URL for you to register for that webinar, and we will repeat that again at the end. So welcome, everyone. Thank you so much for joining us. As I mentioned, my name is Holly Avey. I'm going to be providing the webinar this morning for you to talk a little bit about screening. Thank you for joining us. Oh, okay, I'm having a little bit, let me just check here. I'm not able to advance my screen. Let me see if the organizers might be able to help me out with that. All right, maybe we can move forward now. There we go. Okay, thank you. All right, sorry for all the glitches. We're going to get going and have a fabulous webinar for you. So I'm going to talk with you this morning about exploring the promise and practice of health impact assessment through screening. As you can, and goodness, going back to, there we go. All right. Screening is one of 6 steps of the health impact assessment process, which also includes scoping, assessment, recommendations, reporting, and monitoring and evaluation. Screening is the first step, and it's the step where you actually determine whether or not a particular topic is a good fit for a health impact assessment. Let me just give you an overview of the topics that we will be discussing during the webinar today. I'll be talking with you about some basic yes-no questions to get you started in determining whether or not an HIA would be, a topic that you have in mind would be an appropriate topic for an HIA. We'll then discuss some additional considerations. I'll talk with you about some of the outputs that you may have as a result of going through the screening process, share with you an example of some lessons learned in the health impact assessment that the Georgia Health Policy Center has conducted. We'll talk about a few examples to think through some of the questions that I'll be offering you about screening for an HIA. I'll mention with you some of the tools that you can use and resources for further information about screening and about health impact assessment in general. And then we'll end with some strategies for identifying potential projects and partnerships for health impact assessment. The first question that you can ask yourself: is there a decision regarding a policy, plan, or project that's currently under consideration whose outcomes are likely to impact health? This is one of the questions that I think is the most critical in screening for a health impact assessment, and it's one of the places where people sometimes have a tendency to get a little stuck, either in trying to apply some other forms of assessment to a particular topic area or not quite fully understanding what we mean by talking about a decision. So I will talk with you more about this, but one of the things that you want to keep in mind is that a health impact assessment is conducted to assess the health impacts of a particular policy, plan, or project that is currently under consideration, and to inform the decisions related to those that impending project or plan or policy with the findings from your health impact assessment. So it's very timely in that regard. The second question that you want to ask yourself is whether or not there are specific decision, if the decision-making process would allow for input from a health impact assessment. You want to make sure that if you go through the process of conducting an assessment, that your input would be valued and would be taken into consideration, and that the actual structure itself would allow for that. There may be some times when a process would, for regulatory reasons or for decision-maker reasons, would not allow for the input to be considered. Another screening question to ask yourself is, are there health considerations that are currently explicitly a part of the discussion, and would the HIA bring new information to the decision-making process? So in the U.S., health impact assessments have not been conducted as frequently as in some other parts of the country. And many people in the field here in the U.S. feel like the best value for a health impact assessment is when it is conducted in a sector that is outside of the health sector. So it's really providing very valuable new information to decision makers that they may not have otherwise considered. A health impact assessment could technically be applied to a decision point that would be within the healthcare setting or within the public health setting, but those topics are often already bringing health into the forefront of the conversation, and therefore an assessment, an HIA in that particular topic area may not have quite as much value as if you were able to do it in another sector. Another yes-no screening question. Can the health impact assessment be completed within the timeline for the decision and with the resources available? So you want to not only identify whether or not there is a decision that is pending that you could inform with the assessment process, but you also want to be able to nail down when that decision is going to be made, what the timeline is for that decision, and that will help you to determine what kinds of resources you would need. You need to be able to assess how many staff you would have available to conduct the health impact assessment, what type of data you might need to be able to do the assessment, and you want to look to see if you would need to have some additional time to develop partnerships or stakeholder support. One of the critical parts of a health impact assessment is to engage stakeholders and to build partnerships across sectors. In some cases, those partnerships may not already be in place. And if that's the case, you might need additional time to help build those relationships. If you are looking at a particular topic with a timeline that's a very short timeline and you don't have those particular partnerships already in place, that might mean that this particular topic would not necessarily be as good a fit as some others could be. Let's talk a little bit more about what health impact assessment is not as a way to help you understand what it is. A health impact assessment is not used before a policy program or project has even been considered. It's not the type of assessment. There are other types of assessments that can be done, but this is not the type of the assessment that is used to make a case for why a policy or a program or a project should be proposed in the first place. It's also not used after a policy or project or program has been completed as an evaluative tool. It's not used to understand the impact of something that's already been implemented. What it is it's used during a time when this proposed policy or program or project that you're thinking about is under active consideration. So it's in that sweet spot of something that is proactive in the process and that really helps to bring together the opportunity of a decision that's already pending with some information that could inform that decision. So it's not used before to make the case. It's not used after to understand the impact. It's used right during that decision-making process. So you really need to find a decision that has enough detail in it that you could inform it with an assessment and make sure that the information would be willing to be considered by the decision makers in order for it to be a proactive tool. Some additional considerations. Once you get beyond the yes-no questions to screen for specific topic areas that you might be thinking about for a health impact assessment, you can get to the point where you're looking at some additional considerations. One of them might be, what is the likelihood that the HIA findings and recommendations will receive consideration by decision makers? So perhaps a decision-making process technically says the decision makers must be open to feedback from the public, and they must be willing to consider feedback from the public. But you've talked with the decision makers, and you understand that really they are pretty firm in where they're going so far, and they're feeling like and you get the sense that they really wouldn't be open to anything that might steer them in a different direction. Having a conversation with decision makers to kind of suss that out a little bit more might be a great way for you to explore this additional consideration. Another question that you could ask yourself, are there other stakeholders who are willing and able to participate in the HIA? In that case, as you were looking before at the types of resources that you might need in order to complete an HIA, that might be in terms of staff time. Most of the cost of an HIA is related to staff time, and you just need to look at the timeline that is looming for that particular decision point to see if it's a decision that's happening 6 weeks from now, 6 months from now, a year from now, and how much staff you might be able to devote to that process to do the HIA. If you have limited staff, or if you have the option to include other stakeholders in the process, that can really help add some additional resources to your ability to do an HIA. So that would be a good thing to explore in advance. Another consideration is, does the HIA have the potential to increase partnerships, visibility, and support for future HIAs and other health and all policy efforts in your region? Health and all policies is a concept, in case you're not familiar, it's just a concept that policies that happen in other sectors, transportation, education, labor, criminal justice, a variety of different sectors, can all potentially have policies that would have impacts on health. And looking at those potential impacts on health is a way to explore collaborations between different sectors to really make sure that the policies that are created in other sectors are designed in a way to support health as much as possible. If you are looking for a specific topic for an HIA and your goal is to do additional HIAs in the future, or to look for opportunities to build and continue to have relationships with people in other sectors from a health and all policies perspective, then it's important to think about whether the topic that you're looking at the moment has the potential to build those relationships or those partners, or that if you could use it for visibility and to build a momentum for other HIAs or health and all policies efforts. Another part of health impact assessment is to think about different subgroups within the community that may be affected by the health impact assessment, and to determine whether or not there's potential that some subgroups may be more adversely affected by the decision than others. A core part of health impact assessment is to assess from an equity perspective or an equity lens. And so you want to see if there's the capacity to have differential impacts for different groups that are affected by the decision. One final additional consideration: has a group or organization requested an HIA on a particular decision? Sometimes you might have the good fortune of being in an area or a region where there are some other people who already know about what health impact assessment is and are excited about it, in which case they may even come to approach you and ask you to do a health impact assessment. If that's the case, you still want to make sure that the other criteria that we've discussed before would be met. But if if you've met the other basic criteria, and in addition you have a group that has requested an HIA for a particular decision, that might be a really good fit. Once you've completed the screening step of a health impact assessment process, you'll have a variety of different outputs that you could have as a result. One of them would be a description of this decision that is pending, the proposed policy or program or plan, that would be the focus of the HIA. So you would describe what that topic is, what the decision is. You'd also describe what the timeline is for the decision, when the decision makers are likely to have their final version of this policy or program or plan, what the intervention points are for the HIA information to be used. So there might be a variety of different decision points. If you are going to focus on a trail, for example, and there might be a design of the trail, there might be implementation of the trail, there could be a variety of different decision points, and you want to identify where those decision points are so that you can narrow it down to the ones that your assessment information will inform. You would also provide a description of the decision makers and the stakeholders related to the process. You want to define who they are and all of the different stakeholders who may have different perspectives on the issue. You'll also mention a statement of why the proposal was selected for screening in the first place. For example, it might be a topic of interest to your organization. It might be that one of those other organizations or groups that we mentioned before requested this particular topic area. just provide a little bit of background about why this particular topic was selected for the screening process. You also would provide a preliminary opinion about how this particular topic may have potential importance for health. So just a kind of a back-of-the-envelope perspective on how health could have relevance to this particular topic area. Additional outputs could include a list of resource requirements for the HIA to be completed and the ability of your HIA team to meet them. So that could include the staff time that you estimate that it would take and who the staff are that would be serving on the HIA team. It might include additional engagement with other stakeholder groups, whatever you feel like the resource requirements would be for that HIA and how you anticipate being able to address those requirements. It's also really important to describe what the political context is of this decision and the opportunities to influence that decision-making process. There are some situations where a decision may be really contentious, and it's important to have that context and be aware of it as you go into it to inform and provide additional information in the process. It doesn't mean that you necessarily would say if a topic is being really heatedly discussed in a community and there's a lot of contention, that doesn't mean that it's a good topic for an HIA. Sometimes that means it can be a great topic for an HIA because of the fact that health impact assessment is built on the core of engaging stakeholder groups throughout the entire process and providing neutral evidence-based information. In that case, sometimes a decision that's happening in a contentious context could provide, the HIA could provide a mechanism for those stakeholder groups to be engaged in a way that brings about a greater opportunity for consensus or shared understanding and shared goals for the future. But it's important to consider this context and to be able to describe it as you are determining what the screening is for this particular topic. Finally, the last output that you would have for a screening process would be a recommendation. You're going to decide whether or not this particular topic that you're looking at really is a good fit for a health impact assessment or not. It might be that you would say, no, it's not, and no further action is required. It might be that you say, this is a topic that has some health relevance. There's not a specific decision point that's looming, or the timeline is a little too rapid or too far in the future or not quite clear to us when that's going to happen. And there might be opportunities for us to provide health information to the decision makers, but it doesn't quite fit the minimum criteria for a health impact assessment. So we'll offer that information in another way. Or the third option could be that you proceed with the health impact assessment. One of the lessons learned is to, let me tell you a little bit about the Fort Mcpherson Health Impact Assessment that we conducted here at the Georgia Health Policy Center. When we were first involved in the project, we knew that there was this 488-acre Army base here in the city of Atlanta that was going to be closing as a part of the Department of Defense's base realignment and closure process. We wanted to see if there was an opportunity for this redevelopment of this property in the city of Atlanta to be informed with health information and to specifically inform it with a health impact assessment. But we had to first understand a little bit more about what kinds of things happen during a redevelopment process. None of the people here at the Health Policy Center had ever worked on land use planning before. None of us had any professional relationships with other land use planners or developers or designers. So we were really starting from scratch in terms of understanding other sectors and trying to figure that process out. So through learning by talking with the different stakeholder groups, identifying who the stakeholders were, the redevelopment authority, the city that was going to be designing the zoning for the property, the community stakeholders. We talked with all of these different groups to try to understand the process better, and we did some assessments, some literature reviews, that sort of thing, to try to see if there were any documents that could help us understand that process. Through going through those two different mechanisms, we were able to identify that there are 3 key decision points that happen during a redevelopment process, such as the one that we were focused on. And that includes design guidelines. So they would design a specific design for this particular property and how they want that, how they imagine this property might be reused. And that resulted in a map like the one you see on the slide, which shows that there could be a portion of the property that has mixed use, a portion that's focused on employment. There might be some green space areas, some residential areas, that sort of thing. So that was a design that they were focusing on, they were going to be going through, excuse me. Excuse me. Another part of the decision-making process was that once the design was made for the property, they had to make sure that the zoning for the property would support their ideas for how the property would be used in the future. And the previous zoning did not align with that, so they knew that they were going to have to revise the zoning guidelines. And the third element was the developer's agreement. That happens when the property has been transferred to a private owner. Maybe a parcel of the property is sold to a developer, and the developer has to sign this agreement that says, I agree to follow these particular guidelines in how I go about developing this property. So we identified these specific decision points. We talked with the stakeholder groups and tried to identify when the decisions would be finalized for each of those different decision points. And through that process, we identified that the zoning blueprint at the time we thought would be finished within the next 2 to 3 months. And we decided that would be a good opportunity for us to do a rapid health impact assessment to inform that process. And we were doing rapid because we knew that we didn't have a lot of resources to dedicate, and we wanted to be able to wrap it into a larger project. So zoning blueprint was a good fit for us to do a health impact assessment. So let's talk through a few more examples that are a little bit more hypothetical about what could be a good HIA, thinking about different topics, and thinking about what topics might or might not work if you use the criteria that we talked about before, the 4 questions related to, yes-no questions related to an HIA topic. One of them is, would a children's health insurance program expansion, the criteria for participating in a children's health insurance program, if that criteria was expanded, would that be a good topic for an HIA? If there's a plan to expand the criteria for enrolling in a children's health insurance program. One of the questions to ask yourself, is there a decision point that's likely to impact health? In this case, the decision is whether or not to expand the number of children that could potentially enroll in children's health insurance. That definitely has a relationship to health. And so there is a connection to health, and there is a pending decision because there is a proposed plan that's on the books, and people are looking at whether or not to engage in that plan. Does the decision-making process allow for input? Let's say, and these are all hypothetical examples, so I'm just making this up as I go along. Let's say that there is opportunity to provide feedback to the decision makers. It could be a health insurance program itself. It could be the state. It could be state legislators. Let's say whoever those decision makers are, that you've identified them and they are willing to take input from an HIA. The next question, is health already a part of the discussion? In this case, you know that children's health insurance has health as a core component of it. So health is already going to be a part of the conversation. You know that the impact is how many children are going to have access to health insurance coverage, and that health insurance has a very intuitive, strong relationship to health outcomes. So would the HIA bring new information from a health perspective? That might be a no criteria in this particular case. You might say this particular topic could be limited from HIA perspective because health is already so much on the table that there could be other topics that you could contribute more to. So let's say that's going to be a no for this particular topic, and go on to the next topic. What happens if you're looking at a topic for a proposed initiative by a mayor's office to use unused green space for community gardens? So is there a decision currently under consideration? There is a proposed initiative, yes, so there is a decision point. Is it likely to impact health? Yeah, I think it's pretty intuitive that a community garden and access to community garden could mean that people might have access to more fruits and vegetables than they would otherwise. There's definitely potential for that to be related to health. Does the decision-making process allow for input? That might be dependent on who the decision maker is. If it's coming from the mayor's office, It might be dependent on whether or not this is a personal initiative of the mayor, whether or not the mayor is open to feedback. If it's an elected official, sometimes that means that there might be more opportunity for public comment and feedback, or it might mean that there's more political pressure and that the decision maker might need to pretty much already have their decision made. So you might want to check in with someone in the mayor's office to assess that more. Is health currently part of the discussion, or would an HIA bring new information? In this case, they may not be thinking quite from the health perspective. They might be thinking in terms of people having access to fruits and vegetables, but they might not be thinking of other elements like the potential physical activity of engaging in gardening, or the connection for people who don't have other sources of fruits and vegetables. And can the HIA be completed within the timeline and with the resources available? You might want to see where the mayor's initiative is in the process. It might be something that this has been offered by the mayor as an important topic for him or her, but perhaps that there's no specific timeline until when this decision might be made. So you might need to assess whether or not there is a specific concrete timeline that you could work towards to inform, and how that would determine what resources might need to be available. Let's go to the third topic. There might be a community development plan to recruit biodiesel industry to an area. Is there a decision currently under consideration that's likely to impact health? So there's a plan to recruit an industry. Is the plan the decision point? Is the plan trying to decide whether or not to recruit industry? Is it whether or not they would be successful in recruiting a particular organization to engage in biodiesel? Or would the decision be what happens when a biodiesel organization sets up shop and how that would impact people in the area? There could be a variety of different decision points that you might focus on there, and some of them might have more potential than others. If the community is still at the stage where it's thinking about recruiting, it hasn't actually successfully recruited an industry yet, there isn't actually an industry that is planning to go into a specific location or with a specific type of biodiesel, those questions might mean that there's a little too much ambiguity for you to focus a health impact assessment on. However, you might be able to focus on any one of those decision points if you feel like there's enough information for you to do an assessment for each of those processes. You want to think about, does the decision-making process allow for input? If a community has developed a plan to recruit biodiesel to their area for economic development, they may have already made a decision that this is what they're going to do. So providing additional information about the health impacts of going through with this may not be relevant to them if they've already made a decision from an economic perspective that biodiesel is the way they want to go. You'd want to check in with who the decision makers are in that process to determine that. Is health a part of the discussion, or would HIA bring new information? In this case, it's likely not to be a primary part of the discussion. There might be some people who are mentioning it for a variety of different reasons, but it could be that a health impact assessment could really bring additional feedback and information. And again, would the HIA be completed within the timeline and with the resources available? That's where the ambiguity in the decision-making process could really become challenging if you're not sure which decision you're focusing on or when the timeline would be for those different decisions. If a community decided in general that they wanted to recruit a biodiesel industry, but they didn't have a specific time frame on when they would make that decision or when they would determine whether or not they've been successful in recruiting, that could also be a challenge for the HIA process. So let's go to a final example. One more, let's talk about a topic for a policy to fund scholarships to state universities through lottery funds. Is there a decision currently under consideration that's likely to impact health? There is a pending policy, sorry, that was my error, I should say a pending policy to fund scholarships. So there is a decision. Some decision makers are trying to determine whether or not it would be a good idea to have this particular policy. It might be a policy that the universities are considering or that the state legislature is considering, but there is a decision that's pending. Does the decision-making process allow for input? That might depend on who those decision makers are and what their process is. If you were going to do an assessment of pending policy in state legislature, it would be really important for you to know when that policy might be up for a vote and what the process would be in terms of the topic perhaps going to a committee for consideration first, what the timeline is for the legislative process, and where the best opportunity would be for you to inform that decision-making process. You want to ask yourself if health is part of the discussion, or would HEIA bring new information. Again, this is probably a topic that has a lot of potential for health to not already be a part of the consideration, and you could really have a great opportunity to incorporate health into a consideration about improving educational opportunities for people, as well as the counter side of what are the health implications for encouraging additional engagement in gambling activities. So you could look at it from a variety of different perspectives, and bringing that neutral way of assessing all of the different resources or types of information could be appealing to the decision makers. Can the HIA be completed within the timeline and with the resources available? As I mentioned, you'd really want to be able to understand more about the decision-making process to be able to determine what that timeline is. When I shared these particular topics with some others in a recent training, feedback from one group that was discussing this topic, they said, we don't think this is a good topic because it's just too big. It would be overwhelming to work on. So one of the things that you want to think about is how big of a population would the decision affect? If this is the case, it might affect the entire population of the state if the decision were implemented, and that could really have an impact on what resources you would need to be able to complete the health impact assessment, how big, how extensive your assessment might need to be, what types of data would be available, that sort of thing. So these are things to consider as you're going through specific topics. There are a variety of different tools that you can use to go through the screening process. You can use a checklist, you can use a worksheet, you can use matrices or tables that might have different criteria for a project. And there are a variety of different completed HIAs and organizations that offer these tools that you can go to for further resources. So for example, in New South Wales, there was a health impact assessment screening list that was created, and the reference is below. That's one particular tool that's been used in the past as a screening opportunity to look at different topics. Another is a checklist that was developed by the University of California in Los Angeles that is specifically focused on health determinants, primarily around built environment, but some other criteria as well, and that has been was contributed very early on in the health impact assessment field in the U.S. There are also resources that are offered through groups like Human Impact Partners, which offers a screening worksheet, as well as the National Network of Public Health Institutes, which offers a screening worksheet. That's the one that we have been most familiar with here at the Georgia Health Policy Center. An additional source for screening is a matrix like this one that is offered by the Oregon Public Health Institute. This might be if you've gotten to the point where you've maybe done 1 or 2 health impact assessments, you have a little experience under your belt, and you're starting to look at, now I understand what general topics are good for an HIA, and I really want to maximize this next topic that I choose to make sure that it helps me to move forward in developing my HIA experience more, or to help me move forward in really establishing relationships with some people in a specific sector that I want to connect with. Having a criteria matrix like this could really help you work through some of those nuances more. There are also organizations that offer additional resources that can be very helpful in the screening process. There was a recent report that was produced by the National Research Council that is a great description of the different steps of health impact assessment, and this is the source where we got the information for the outputs of screening that were mentioned earlier. I highly recommend looking at this resource if you haven't already. Human Impact Partners also has an HIA report guide, which can be very helpful in determining what the results of a screening process might look like in terms of the final report. And both of those products, as well as many others, can be found at the Health Impact Project website, which is listed below. When you're going through the process of trying to identify topics for a health impact assessment, you may get to the point where you're trying to figure out, so how do I get these ideas in the first place? Where do I start? There are a variety of different things that you can do to get started in the process. One of them is trying to establish relationships or partnerships with people in other sectors. And I've sometimes told people it's kind of like dating. You really kind of have to ask somebody out and go to coffee, go to lunch, that sort of thing, and just get to know people. So you might talk to somebody that you meet in a meeting or that you're connected with through another connection with someone else. Just spend a little time with someone in another sector and get to know a little bit more about what their work is like, what some of the specific projects are that they've worked on, and that will help you to understand a little bit more about their particular sector. As you continue to build relationships with people in these other sectors, you may be able to identify the particular opportunities for projects, as well as actually ask them to help you identify those projects as they start to understand more about what the potential of health impact assessment is and how you could work together. Another way to look at topics is to identify and cultivate champions in these different sectors. Having someone who understands what health impact assessment is, who's really interested in looking at collaborative opportunities, and who wants to engage in those activities and really champions the opportunity of looking for that collaborative effort whenever possible, can be a great way to help build that opportunity in the future. If you're looking for specific health impact assessment topics that are policy related, one way to look for policy ideas is to scan through upcoming agendas, community meetings, known health issues, and really try to keep your finger on the pulse of what's happening in the policy-related community to see what's coming down the pike that way. You can also find inspiration by attending local or regional conferences, especially conferences or presentations by people in other sectors that may spur your interest, and engaging in groups, work groups, networks, professional organizations that are dedicated to health impact assessment can also be a great way to identify specific topics. So just to summarize, what we've talked about so far are the criteria that you would use to determine whether or not a topic is a good topic for a health impact assessment. That might include some of the 4 basic yes-no screening questions. Is there a decision that's pending? Would the decision allow for input? Is health a part of the conversation already, or could this add to the conversation? And what are the timeline and the resources needed to be able to conduct a health impact assessment? You now know that HIA is not something that happens before a decision is considered or after it's been implemented, but it is a process that you offer during a pending decision to be proactive. There are some additional considerations that you can think about when you're trying to pick an HIA topic, including whether or not the recommendations will receive consideration, if there are stakeholders willing to participate, if there's potential to increase the partnerships, the connections, the visibility, the potential for future HIA work, if there's potential for differential impact on subgroups, and if there's been a request from a group or an organization for the HIA. The outputs that you would receive as a result of going through the screening process include that description of the project, what the timeline is, where the intervention points are for decision making, who the decision makers are and the stakeholders, why you selected this topic for the screening process in the first place, how it might be related to health, what the resources would be to engage in this particular topic for an HIA, and what your ability of your organization is to meet them. Describe that political context of the decision, and what your recommendation is on whether or not it would be a good topic for an HIA. And I believe that takes us to the end of the presentation at this point. Lori may be able to join us at this point to see if there might be any questions from the listeners on a discussion that we could have at this point moving forward. Lori, are you able to join us? All right, so we might not have audio yet to be able to hear from Lori on the on her end of things. Let's see if we might be able to explore what the questions might be from. Oh, Lori, is that you? Okay. If there are others who have questions who've posted those questions in chat, we might be able to share some of those questions so that we can answer them.
Hello, this is Lori Stillman. Can people hear me?
I can hear you.
Okay, well, we apologize for the technical difficulties that we've been having, but we want to thank everybody for joining this webinar. This is Lori Stillman. I'm the Chief Strategy Officer at Health Resources in Action, and I apologize for not being able to properly introduce our speaker, Dr. Holly Avey from the Georgia Policy Center. She did a wonderful job trying to explain to us about the screening process involved with health impact assessments. We have a few questions that have come in, and following those questions, I will properly introduce Health Resources in Action and our funders as well as our sponsors, but I know that people would like to first hear answers to the questions. So the first one that I would like to pose to Dr. Avey is, can you please elaborate on the issue of resources and timeline? Is it conceivable that a rapid HIA could be done so in such a cursory fashion that it's really not robust enough, yet decision makers may rely on it? What responsibility do we have as HIA providers at the screening stage to inform a decision maker that there just isn't enough time to do a robust enough HIA? Might it be tempting for an HIA provider to go forward with an HIA even though the resources or timeline is insufficient? So Dr. Avey, do you want to take a crack at that question?
Sure, that's a really good question. And this is something that there's no specific answer to in the field of health impact assessment, but one of the things to consider if you're looking for examples of the range of extensive assessments and results that have been completed through the health impact assessment process, you might want to visit the Health Impact Project website or the UCLA HIA CLIC, C-L-I-C website. Both of those locations offer a listing of health impact assessments that have been completed in the U.S. to date. And looking through the reports of those different health impact assessments can really give you a great idea of the vast range of health impact assessments, how some of them have really been very cursory and rapid, and others have been incredibly comprehensive and have taken up to a couple of years to complete. In terms of whether or not there's ever a time when a health impact assessment, there's just not enough time to complete one in a rigorous fashion, I think that's a question that would be up to your organization to determine whether what the quality of the assessment might be able to be within the timeline of the decision point. I can tell you from my perspective that it's important to balance having enough time to provide accurate information with the perspective that you don't want the perfect to be the enemy of the good. You don't want to say there's just not enough time to really do a comprehensive look at the literature, a comprehensive assessment of all of the different angles, and therefore we just don't have the opportunity to inform this decision. One of the great things about health impact assessment, in my mind, is that these are decisions that are going to happen whether the HIA informs them or not. It's not as if the HIA doesn't happen, the decision's not going to happen. This is a process that's already happening in another sector, and you have the opportunity to provide them with some additional perspective on what that decision might be. Is it important for that to be the most comprehensive, most accurate information possible before you offer it to them? Or is it better to have some rather than nothing? If you have some general assurance that the information that you can provide, even if it's cursory, could still be useful and accurate. And a few ways to do that might be, again, to go back to the HIA literature, see if there are other HIAs that have been completed on similar topics that you could pull from to get a head start in your assessment process, a variety of different ways that you can look to streamline the process. But in many cases, it might be that some information could be better than none at all. And that is a call that would be appropriate for you to decide on an organizational level.
Thank you. And a related question, who typically pays for an HIA?
Yep, good question. There are a few locations that fund health impact assessments. There are the California Endowment has funded some, especially in the California area in the past. The Health Impact Project funds some. The Centers for Disease Control and Prevention has funded some. There are other organizations that are looking at potentially funding some health impact assessments in the future. In many cases, there are local health impact assessments that have been funded through foundations or private organizations. If health impact assessment is being done on a natural resource extraction, there are sometimes when the industry itself will fund the HIA. Interestingly, because they have found that it is to their financial advantage to contribute the funding to an HIA from the very beginning, because it has such a strong stakeholder engagement component to it, that even if they spend the money on conducting the HIA and incorporating the recommendations, it still saves them money in comparison to litigation that they might have to be faced with if they didn't go through that process. Now, that might be more specific to a specific type of or topic of HIA, but there are a variety of different sources to look for. And in addition, it's important to remember that if this is the first time that your organization is thinking about health impact assessment, don't rule out the potential to self-fund it. That's one of the things that we did with the Georgia Health Policy Center, and that's one of the ways that we were able to kind of get a foot in the door in this field, and we did it strategically by focusing on a fairly rapid version, and with limited dedication of staff resources, we were able to combine it with another project and really help to streamline that process that way. But there are ways to scale it something to be a little bit more appropriate if you need to look at combining resources and looking at least partially self-funding it.
Thank you. We only have a few more minutes, so we may only have an opportunity for one or two more questions. A lot of the people who are participating on this phone call, however, will be part of the conference, and I want to assure them that a lot of the questions that are coming through on this webinar will be addressed in a deeper way at the full-day conference on May 31st. The next question, Dr. Avey, is about whether you can give an example of a project that resulted in a denial of a health I guess of a permit or environmental permit, or you know, some other kind of project or plan that the health impact assessment, for instance, might not be value added, but literally result in the project not moving forward.
Right. That's a really important question. I can't say that I can think of a specific example where that's been the case, but that does bring up a very important point, which is that the result of a health impact assessment and the recommendations that come about after a completed health impact assessment are not designed to say, yes, this is a good decision that you're thinking about, or no, it's not a good decision, you should not do it. The idea is to pick a topic that has enough detail in the proposed plan or project or policy that you look at each of the specific elements of that proposed decision and you say, what would be the health implications of this part of the decision or of that part of the decision? And your resulting recommendations are to say, if the decision happened, then it could have this negative outcome on the health population, and our recommendation is to engage in this activity as a way to mitigate that potential problem. And that you would have a whole list of recommendations that would be specific to each of the different components of that decision, so that you don't come across by saying yes or no, thumbs up or thumbs down. You really provide a very nuanced perspective on this element could be a good thing, this element could use some support. If you take this strategy, then it could be very much strengthened in that way.
Terrific. Well, it's 1 minute to 11, and I would like to wrap up and say a few things that we didn't get to say at the very beginning of this webinar. I first wanted to say thank you so much, Dr. Avey, for really going into depth more about the screening step of the webinar process, and that there are 6 components. More of those components will be addressed at the conference on May 31st, and then there'll be another webinar on June 13th from 10 to 11:30 that will address in more detail the final steps of an HIA. Today's webinar is part and parcel of a New England training series entitled The Promise and Practice of Health Impact Assessment, sponsored by Health Resources in Action and funded primarily by the U.S. Centers for Disease Control and Prevention. It's being co-sponsored by the Mosekowski Institute for Public Enterprise at Clark University, the New England Alliance for Workforce Development at the University of New England, the New England Biomass Coalition at the University of Massachusetts Lowell, the New England Coalition for Health Promotion and Disease Prevention, the New England States for Coordinated Air Use Management, and the U.S. Department of Health and Human Services New England Region 1 office. The U.S. EPA Region 1 is also serving as an advisor. We will be holding a full-day conference on May 31st at Clark University. At that time, we're going to have health practitioners in the field come and talk to us about what it's like to do a health impact assessment so people really can understand in greater detail what it's like to put HIAs in practice. And we'll learn more in depth and go get a better understanding of some of the key and most interesting elements of the HIA. Dr. Holly Avey will be one of the key trainers. We have a number of other folks as well. If you have any questions, please email Allison Scherb at ASCHERB@HRIA.org. Again, this is Lori Stillman at Health Resources in Action. We are a nonprofit national public health organization located in Boston, dedicated to strengthening communities, advancing health equity, and accelerating medical discoveries. Thank you, everyone, for joining this webinar. We have recorded it, and we will be sending you a link so that you can listen to it again if you'd like more information, or send it on to your colleagues. And we will be sending you more information following this webinar about the conference and webinars that are being held in the future. So thank you again. Dr. Avey, you did a wonderful job at the Georgia Policy Institute, and we look forward to having all of you join us again in the near future. Take care. Bye-bye.